Dr. Donnelly, talk about once a patient, you identify that, okay, my clinical reasoning has drawn me to this point where I'm going to choose to draw a needle. Mm-hmm. I'm going to test and retest to make sure that we're seeing effectiveness. How many times, oftentimes, do you see patients? Is it just the one and done, or
it can be? I mean, if somebody has an active trigger point, many times it can be a one and done. And if somebody has persistent pain, then it's a whole different story, because you're really looking for pain neuroscience education, and where does the dry needling fit into changing the central nervous system processing dysfunction. That's a little more complicated and challenging, right? So more than a couple of visits, probably not. And again, the conversation always comes, some patients just want the needle, like they want a manipulation. Then it becomes a service, right? So, it's not part of active rehabilitation. Patients values and circumstances. If they value the needle and want the needle and are not willing to participate in the post-rehab exercise and conditioning and wellness stuff, then it becomes a service.
So in those instances, you'll deliver the needle just to have their buy-in, so that then they'll go through with you with the more important things that you feel like truly would have a lasting improvement.
Not necessarily. I've had patients come in with referrals that say dry needling, and I was like, no, we're not dry needling. You're just not a candidate for dry needling, right? So you have to go on both sides, right? Sometimes, if I think dry needling of trigger points will be helpful and the patient's a little hesitant, sometimes I'd put them next to each other in the clinic and let a patient who's had success with it talk to the patient that might be a little fearful or a little dubious about it. Yeah. And let the patient decide, give them an information sheet, let them learn about it, let them read about it. Because we all know that patients' attitudes and beliefs matched with the clinician's attitudes and beliefs is the best predictor of a great outcome. And that's a fact.
Yeah.
And it's well published.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.